Let's begin on the hands and knees position. Hands under your shoulders, knees under your hips, head looking straight down, shoulders away from your ears, a little bit of engagement of your belly, and just loosen up by swaying your hips side to side. Loosening up, oiling up your shoulder joints, your hip joints. And then do some swivel hips, U-shaped. We're going down and up, back and up, side to side. And then turn that into circles. Nice, easy, smooth circles. And then reverse your circles. Come back to neutral. And do some cat-cows. Breathe in and your head and tail come up. Blow out and your head and tail drop down. Breathe in, head and tail come up. Blow out, head and tail goes down. It's nice, easy reversals. You can also do this on your fists if your wrists start getting tired. Let's continue your cat-cows in a fisted position. You can also do this with your knees together and your feet apart. So your hips are in a little bit of an internal rotation. Especially in the later stages of labor and at delivery, it can feel good to have your hips in an internally rotated position. And for hip movement today, let's also bring your knees apart. Bring your feet back in, put your knees apart, and do some cat-cows in this position. Breathing in, blowing out. Breathing in, blowing out. And you can also put yourself on your elbows, on your forearms, in a puppy stretch. A little bit of an inversion here. Same thing, doing the cat-cow, bringing baby off the pubic bone, breathing in, breathing out. Now come back to neutral. Another version is a moving cat-cow. So you're going to pretend you're going under a fence. So your head goes under and forward and up, and then you come back down under the fence and round your back. Under the fence and up, back under the fence and back. Getting a little bit of triceps work in here. Good. And back to neutral and rest, swaying your hips side to side. And come back to neutral. And we're going to do a side bend. So take your shoulder towards your hip and your hip toward your shoulder. A little bit of hiking. And then you do the other side. So you're stretching out the muscles on the opposite side that you're hiking to. Here your left hip and shoulder are meeting. You're stretching your right side. Here your right hip and shoulder are meeting. You're stretching your left side. Just keep breathing easy, stretching out those lateral side muscles. And when you're ready, come back to center and do your hip sways again. And come back to center, and we're going to add a little rotation. So breathe in, let your elbow come up and twist, looking at your hand, come back under, lift up again, breathe in, come back under, lift up again, and this time come back under and stay there, using a pillow if you need to support your head. You could also use a pillow to support your belly. Relax in this position, softening your eyes and your jaw, softening your throat, your shoulders, softening your back and your belly, softening your buttocks, your pelvic floor. Use the minimal muscle effort needed to be in this position. Nice little inverted position. To come out of that, take a breath in, look at your elbow again. Come back to neutral and do the same thing on the other side. Breathe in, look at your elbow and under to get a twist in your spine. Breathe in, look at your elbow, blow out. Breathe in, look at your elbow. And this time all the way under, and if it's comfortable, rest in this position. Using the minimal muscle effort needed to stay in this position. Softening your scalp, your forehead, your eyes, your ears, your jaw, your lips, your tongue, your throat. Relax your shoulders in this position, your spine, your belly, buttocks, pelvic floor. Let your breath be slow and low. And then come back out of the position, lifting your elbow in the air, breathing in, and then back to a neutral position and some hip sways again. Now I'll do a little bit of strengthening for the back line muscles. Neutral position of your body, and lift your opposite arm and leg in the air. Thumb is up, belly's a little tight, jaw is soft, working your balance, working all your core muscles, staying strong through your pregnancy. And lower down, take a breath in. On the exhale, lift the opposite. Elbow straight, thumb up. And down. And we'll just do one more each side. When you're ready, on an exhale, lift. Jaw soft, belly, buttocks, pelvic floor engaged. And release. When you're ready, on the exhale, lift the opposite sides. Hold and breathe. And come down, sway side to side again. And now take a block and place it under one knee. And lift the opposite knee in the air. Getting some rotation of your pelvis, mobilizing that SI joint. Very good. Good rotation. And then switch with the block, place it on the other side. It's good to keep some asymmetry in the body. Helps the baby be able to find the best position. Good, and then take 2 of your yoga blocks. We're going to do a forward lunge to open up the hip flexors. Put one leg forward. Adjust your blocks as needed, and then stretch forward and do some circles. Circles one direction, opening up the hips, only if the pubic area is feeling comfortable. And circles the other direction. Then come back to neutral and lift both your arms in the air. Your balance is feeling good. Nice balance pose, nice strengthening pose. A little bit of stretch in the hip flexors while you're also being strong. Jaw is soft, arms are strong, legs are strong. Breathing. And come out of that position and switch legs. Adjusting the blocks, adjusting your body as needed, and do some circles with this leg, opening up the front of the thigh. And reverse circles. Nice, easy circles, just within your comfort range. And then stay forward, and if your balance is feeling good, go ahead and lift your arms over your head, elbows straight, jaw soft, shoulder blades down your back, legs strong, arms strong, jaw soft. And come out of that position. Do some hip sways. And anything else that might feel good before we go into child's pose. You can do your circles or swivels again, or stay with sways, whatever feels good. And now get pillows or blocks if you need them. Separate your legs a comfortable distance. And go into child's pose. Just softening. Your hands can be in front, they can be to the side, whatever's comfortable. Soften your scalp and your forehead. Soften your ears, your nose, your lips, your jaw, your tongue, your throat. Relax your shoulders, your upper back, your chest. Let your baby sink down into the pillow supporting it. Nowhere to go, nothing to do, no problem to solve right now. Letting your body be at ease, opening up the back, opening up the buttocks. As you breathe in, you'll feel the tailbone, tip of the tailbone move toward the ceiling, and the sit bones move away. As you blow out, sit bones move toward each other, tailbone comes back down a little. So you breathe in, there's an opening, a blossoming. When you blow out, there's a release from that blossoming. Just feel the opening and closing of the pelvis as you breathe. And feel the baby getting a gentle rise and fall, gentle movement of the baby as you breathe. Stay in this position as long as you like. When you come out, move slowly and gently, with gratitude that your body can do these movements, with gratitude for the baby, with gratitude to yourself that you did this movement work today.